Hey guys, this is Jeremy and welcome to my YouTube channel. I guess this is kind of my first video. Um, I have a lot to say. I'm not going to talk very long. I plan to make a lot of videos. I am on a big journey to reclaim my health. So let me just kind of get into it. If you're here because you are friends with me on Facebook, you probably know some of this. If you have stumbled across me on YouTube, you may not. But let me just start at the beginning and say that for the past several years, I've been trying to lose weight. Now, the good news is I have lost some weight. About a year ago, I weighed 434 pounds. As of this morning, I weigh 373 pounds, which is a loss of 61 pounds. I'm pretty pleased with that. This is what I looked like at my biggest. As you can see, I lost weight. I'm also trying out a beard for the first time ever. I think I like it. So feel free to tell me on that as well. But I need to lose a lot more. My goal weight is 180, which is still almost 200 pounds away. So I've got a lot to go. I have tried different ways to lose weight, but I've always stopped. So that's kind of the first thing I should disclaim. I am partially making these videos to hold me accountable. But something happened in this last year that has made me realize how immensely crucial and serious and important and vital and cannot wait any longer it is for me to lose weight. And if you've seen this right here, it says, "But seriously, get screened." That might give you a hint. If you know me, you know this. If you, again, don't, you didn't. So I'll just tell you right now. I was diagnosed with colon cancer last year. I have had poor bathroom habits for a while, and if this is a little TMI, I apologize. I'll try not to get too graphic, but don't worry, I'll definitely keep this family friendly, but we are talking about colon cancer, so poop will definitely come up. I have had kind of an orangey, bloody mucus in my stool, maybe once a week, maybe every other week, for about a year. I honestly blamed it on my poor eating habits. I thought, I eat a crappy diet. Well, of course there's going to be some problems down there. And that was kind of the extent of it. I had a bladder pain, of all things, last June. We had just returned from a vacation, and I didn't get to drink much, especially on the drive home, because it was a 12-hour drive home. So I thought, well, I didn't drink much, and I somehow got a UTI. Now, men usually don't get UTIs or urinary tract infections, but that's, it burned when I peed. It just kind of ached generally, and I thought, well, that's probably what it is. No big deal. Let me go to the doctor. I went to urgent care, actually, and pick up a prescription. Well, they prescribed me a medicine whose name currently escapes me for it. They gave me a urinalysis where you pee in a cup and they analyze it, and they said, well, you don't have an infection, but you do have a lot of white blood cells in here. So I took the antibiotic. It was terrible. It caused crippling stomach cramps. I don't know if the medicine caused it or if something else caused it, but in any event, I can only take it for a few days. They switched me to a different antibiotic that I could tolerate better. Here's the kicker, though. My bladder pain never really went away. It got better, and because I'm a man, and therefore when it comes to medical issues, I'm remarkably stupid, I ignored it. The bowel habits were about the same. I would occasionally have, kind of a slightly bloody, mucusy bowel movement, but nothing that was really too concerning, which is really dumb. I realize how stupid that is to say now, but I wasn't concerned. If you have blood in your stool, go get it checked. And let me just keep telling my story. In September, and I'm a professor, so I was teaching a night class, and before class started, I went to the bathroom and I peed in the toilet, and it had blood in it. It wasn't like pink blood, but it was definitely discolored in a way that I knew, okay, that's blood. It didn't happen again. I talked about it with my wife. We were like, okay, if it's just a one-time thing, maybe something weird happened, but it happened again that Sunday night. So I immediately called and made an appointment with a urologist. It's a cold call. I literally Googled a name, someone in my city. He wasn't available until October, but that was the quickest I could get in. And that was, at this point, 4 to 5 weeks away, and his secretary recommended that I still go see my primary care physician to possibly get this treated before then, because it might be nothing and they can solve it before then. So I went back to my primary care physician, and this time urinalysis showed there was red blood cells in my urine. I should mention that the urine wasn't always red. I would pee blood maybe twice a day, but in this sample, which looked a little cloudy but didn't look red or pink or orange or any blood-related color, blood still showed up. And she ordered a CT scan because our first thoughts were that this might be kidney stones. Which, okay, that sucks, but I can deal with that. That explained a lot. It would explain why I had a little bit of an ache on my left side of my body. It would explain why my bladder had been hurting. It would cover a lot in my mind. So I had a CT scan without contrast, which means you don't have to drink the barium. And when I went back to my doctor to discuss the results, I was told that I definitely had diverticulitis, but that I might have a fistula, which would be an opening between your colon and your bladder. Basically, two hollow organs can kind of one can sort of feed through the other, like make a passage between. This is obviously bad. I was given a criteria things. If these happen, call the hospital, go to the emergency room. And it was if I was in excessive pain, if I had any fever, and my favorite, if I passed air through my penis. I was told to immediately go to the ER. And then I was set up for an appointment with a surgeon on Monday. So at this point, I am already freaking out. I'm thinking, great, I have a fistula that has to be repaired with surgery. This sucks. I do not want surgery. Well, I went to see the surgeon who has an amazing reputation. His name is Timothy Witterson. I just mentioned offhandedly to a few people at church who I was going to see, and and just people, like one person, the first person I mentioned said, "Oh, he removed my gallbladder," and loved him, did a great job. So I at least felt that hey, I'm in great hands, which is good. I go to see him, and he said that because I did a CT scan without contrast, there's not much he can see. Everything is just kind of, it doesn't light up much. So he basically wanted me to do another CT scan, this time with the barium contrast, and see a gastroenterologist on Friday of that week. So on Wednesday, I drank the barium, did my CT scan, and just so this is said, the barium drink is not that bad. This is going to sound disgusting, but it made me think of drinking a milkshake that was grape and chalk flavored. If you have to do it, don't let it stress you out. Use a straw. Drink it as quick as you can. It was fine. And it never made me feel gross. I was fine. No problem with that. So I did my CT scan, and then I went to see the gastroenterologist. And he said that the CT scan showed there were definitely some issues. He said there was some abnormal looping in my small intestine, and there was some stuff in my large intestine that he wanted to get checked out. At this point, the fistula was still very much on the table, and he wanted me to do a colonoscopy. So about 2 weeks later, I had a colonoscopy scheduled. If you have never done a colonoscopy, it is the most non-event of a medical procedure ever. The prep is terrible. They gave me something called movie prep, which tasted like salty lemonade. It was awful. And that's to clean you out the day before. But the procedure itself, I did mine under sedation. They put me out. I woke up. It was done. I mean, it was nothing. And at the time, my gastro doctor said, his name was Dr. Rao, like him a lot as well, he said there was he told my wife this because I was still too groggy, but he said there was a section that he wanted to monitor. He took a few biopsy samples, and that I would hear back soon. Well, I had an appointment scheduled to learn the results 2 weeks later. A few days later, maybe 36 hours later, I got a call from his nurse saying, "We've had some cancellations. We'd like to come get you in sooner." That freaked me out, but I did it just the same because I thought they're going to tell me something bad. My medical, I go to Graves Gilbert Clinic, and they have a portal where I can access all the notes, all of my test results and everything. And I basically got to read the results before my gastroenterologist could share them with me. Going back, if I could, I would ignore that. I wish I hadn't read it, but I did. And it told me that basically I was at risk for colon cancer. And that's something that I read this on my phone while my students in my night class were taking a quiz, and that was not the best place for me to find out at all. But anyway, that's how I first found out. And at my appointment, he apologized for me finding out that way and said he was going to talk to their records people to make sure that type of thing didn't happen again. He was really bothered that I found out the way I did. But he basically said that yes, the biopsies show that I was at risk for, make sure I get this right, I had high-grade tubulovillous adenoma, which he said the samples that were taken were very small. At the moment, it looked like it was precancerous. Could be cancerous, couldn't really know until they got in there and removed it. So at this point, I was referred back to the surgeon. Now, in the midst of all this, my bladder is still killing me. I am in pain every day. It hurts like I'm peeing, honestly, 25 times a day, just because the only time I got any relief from my bladder pain was immediately following urination. So I go to, it's actually the day after my colonoscopy, I went to my urologist, and his name is Dr. Bergamini. Love him as well. Great doctor. If you're in Bowling Green, highly recommend Bergamini, Rao, and Weirson. Fans of all three of them. But Dr. Bergamini explained to me that he wasn't sure what was going on, and he wanted to do a bladder scope. It's called a cystoscope, and that is as horrible as it sounds. And they run a tube about the diameter of a pencil up your urethra and to your bladder, fill it with water, and just take a look around with the camera. Which, I mean, medical science is amazing, but holy crap, that sounded awful. But, you know, in for a penny, in for a pound, and I was tired of hurting. So I'm like, let's do it. Let's figure it out. Before we could get that scheduled, that was scheduled for November 16th. Weirson scheduled me for surgery on November 20th because he said I needed to have some of my large intestine removed. Everything that Rao had marked needed to be taken out because if it wasn't cancer yet, it was going to become cancer. My surgery was scheduled for November 20th, and I got a little bit of a break. Bergamini, who was going to have to put a stent in my ureters, which is the tube that goes from your kidneys to your bladder, that stent was going to be placed in to make sure that they wouldn't accidentally be cut during the surgery because there was a lot of inflammation down there. So because he was going to do that on the day of my surgery, he was also going to do the cystoscope on the day of my surgery, which meant I was going to be unconscious for it. So yay for anesthesia. So I did my last day of eating was on November 18th. By the way, this is Thanksgiving week, so I didn't get to have Thanksgiving this year. I started my extremely aggressive colon bowel prep on November 19th. And then on November 20th, I went to the hospital. While I should still mention that my bladder still hurts. I am passing blood in my stool now with more frequency. It hurt pretty much every time I went to the bathroom. And I am ready for surgery, even though I'm also terrified. I made the mistake of doing some Googling, and I learned a few facts that scared me, but they're still the case. Colon cancer, for the most part, is one of the more survivable cancers. There is an exception to that. The younger you are, the more serious it can be. And I am 40. A 70-year-old man who gets colon cancer, it's often not that bad. If you are a 40-year-old man who gets colon cancer, it can often be pretty aggressive. But it is what it is. So I was pretty afraid going into surgery. I'm not going to lie and say I wasn't. I have a 6-year-old son. My wife is the most supportive human being on the planet. I don't know how I would have done this without her. She was my rock. She carried so much of this burden, and I never even knew. She did a lot to appease me. She ordered me to stop Googling medical symptoms at one point. I'll be honest, I freaked out when I found out that the surgery I was having, which is called a colectomy, about 6% of people don't survive the procedure itself, which that wasn't fun to find out. I have a lot of risk factors. I am obese. That's a huge risk factor, but not like I could do anything about it at this point, so I just had to go for it. Again, Weirson came so highly recommended. I knew that if this procedure could be done safely, he was the best guy to do it. So I was scheduled for a Da Vinci operation, which is robotic. It's laparoscopic, and a robot basically does it. He guides the robot. He told me, and I knew this all along, that there was a very good chance that the surgery could not be done robotically, because he said there was so much inflammation in my digestive system. He had to fix my bladder, he had to fix my large intestine, and he had to straighten out my small intestine, because that was, the inflammation was impacting that. That was what caused that bizarre looping. And he said he would do everything he could to keep it laparoscopic / robotic, but that he expected it to be open, in which case I would have about a scar about this wide running down, or bigger, running down my abdomen, where he had to cut me open and just go in manually. There was also the possibility, he said less than half, which that could be anywhere from 1% to 49%. But there was the possibility that I could wake up with a temporary or a permanent ostomy bag, depending on if he could reconnect it or not. And that was, we just wouldn't know until I woke up. So I'm 40, I'm not diabetic, my blood pressure is a little higher than it should be, my cholesterol is relatively okay. Despite my obesity, I've always thought I was healthy. And then in just the course of a few months, I find out that I might have cancer, and that I might wake up from this surgery, if I wake up, that I might wake up with an ostomy bag. So I did a lot of praying going into this. I am a Christian. I did a lot of selfish praying. I prayed to God so many times, please, please save me. I literally said, if I can just, please God, if I can just make it 12 more years till my son Henry is 18, I'll take that. Just please do not take me from my family right now. And he didn't. So I am very grateful for that. I woke up. What was supposed to be a 2.5-hour procedure was a 5.5-hour procedure, but praise the skill of Dr. Rearson, and praise the Lord, he did not have to do an open surgery. He was able to do it with the Da Vinci system, which was great. So instead of having one long incision, I have several small ones. I'm not going to show you because they're on my stomach, and I don't really want to share my big fat gut on screen. But I have one that's about this long, and the rest are this. There's 5 total, and the rest are about this size. I was never really in pain in the hospital. The only thing that really sucked was the catheter. I had to have a catheter in place. Bergamini did his part first, and he went in and he removed a tumor from my bladder, which was very heavily infected, and that was going to be biopsied. And then Weirson, my general surgeon, it took a while, but he removed about 8 to 9 inches of my large intestine. He was successfully able to resection the other ends, so I now have, a little bit less large intestine, but what I have knit together quite nicely. So let me say this: if you stumbled across this video because you're about to have a colectomy, I was nervous, I was terrified, but it was by far the best thing I've ever done. Within 5 days of surgery, I was having pain-free bowel movements. Having a bowel movement never hurt once. Now I think this is because my surgery was higher up in my digestive tract than in near my rectum. I think that may be why it never really hurt. But the way my procedure took place, I woke up, I was immediately put on a clear liquid diet, which meant every meal was Jell-O, orange juice, grape juice, broth. That was what I had for 3 meals a day for about 3 days straight. While I was also on a IV to give me fluids, and I was allowed to drink clear sodas and water. The first step was to to pass gas, because that indicates your colon is awake and starting to move around. So about a day and a half after the surgery, I passed gas for the first time. About another day after that, I had my first bowel movement. It was tiny. It did not hurt. I had a few more. After that, they put me on what they call a full liquid diet, which is basically I can now have pudding, ice cream, milk. Let me have cream of wheat, which was very, still very liquidy, but a little more substance. And then about a day after that, on the day they discharged me, they put me on a low residue diet, which is I could basically eat no more than 13 grams of fiber a day, which is surprisingly tough. I ate a lot of white bread, ate a lot of deli meat, um, a lot of very bland food. You would not believe how much I miss fruit. It was amazing how much I miss fruit. But one hurdle I had that I think most colon cancer people don't is because mine impacted my bladder as well. I had to leave the hospital with a catheter. I had to wear a catheter for 10 days. That was the worst part of this by far. I hated every second of it. I stayed on Tylenol. They gave me oxycodone, but I did not have to take any. Tylenol was enough for me to manage my pain. Except for the catheter, I never really hurt. I was just sore. I felt like I'd been in a car accident or that I'd been beat up. But I was never in any pain other than just the pain of a catheter. And truthfully, the catheter pain was less than what I felt with just this bladder pain I've been having for months. So, the section of my colon that was removed was biopsied, as well as the tumor in my bladder. Before I left the hospital, I found out that the bladder tumor was benign. No cancer there. My urologist looked so relieved when he told me. I think he suspected that was going to be cancer, and it wasn't. So that was great. But I still had to wait for news on the colon. On the day, 10 days after surgery, November 30th, I went to my urologist to have my catheter removed. That was a glorious day. And that was the day that he told me that I, in fact, had cancer. And that message came with a, here's the bad news, but here's the great news. So the bad news is, yes, you had cancer. And in fact, I had a type of colon cancer that was so aggressive, it was invading out of my colon into surrounding organs. And that was what caused the perforation into my bladder. There was a pinhole perforation. That's what was causing the blood. There actually was a tiny little fistula. I had fecal matter in my urine at times and didn't even realize it. But that healed. That was part of the reason I had to wear the catheter for 10 days. And the colon cancer was aggressive, but they got it all. That's the good news. There was a 1 millimeter margin around the excised tissue that was cancer-free. That's phenomenal news. And the best news was that they biopsied 37 lymph nodes around my colon. I didn't even know I had 37 lymph nodes. Turns out we actually have like 700 to 800, but the 37 lymph nodes that they biopsied were also all clean of cancer. So for now, I'm knocking on wood, I am cancer-free. I do need to follow up with an oncologist just to make sure I don't need to do chemo, but I feel amazing. So if you stumbled across this video because you have to have a similar surgery, just know that I feel so good now. I didn't even realize how bad I felt. My bladder, which was very infected, took a lot longer to heal actually than my colon. I am a month and a half out. There's still a twinge of bladder pain at time, but compared to where I was, it's nothing. And my colon is perfect. I'm now eating a regular healthy diet. So I'm talking about poop for a minute. My bowel movements are solid and fewer and healthy looking. They look like normal poops and not diarrhea or orangey, bloody mucus poops. So I'm pretty pleased about that. I feel great. There's a part of me that's like, I feel weird referring to myself as, you know, hey, I had cancer, because I feel like most people who have had cancer had to go through more than I did. I didn't really know I had cancer until I also found out that I'm kind of cancer-free. I say that kind of cancer-free. If you ever have cancer, you don't ever really get to be cancer-free. I'm going to have colonoscopies a lot more often now, which every time I have one, I will share it on this channel, because this will have to be monitored my whole life. And, you know, that's a small price to pay. That way, if it does recur, we can get it before it becomes serious. My bladder is going to have to be examined. I actually have a cystoscope scheduled with my urologist this Friday. Means they're going to go up with the pencil-sized camera up my urethra. I am not looking forward to that at all. I will be wide awake for this one, but you got to do what you got to do to fight cancer, to make sure you stay healthy. So that's what I'm going to do, and I'll share my thoughts on that on Friday after I've had the procedure done. Okay, so this was a long story. I did not mean for this to be so long. But what it comes down to is this. I have not taken my health seriously for years, and I've got to stop. I am too overweight to be healthy. I do not buy into this health at any size crap. I don't think it's a thing. I think you can make healthy choices at any size, but you can't be 200 pounds overweight and be healthy. Just hard stop, can't be done. I'm not healthy, and I have to get healthy. So that's why I'm going to use these videos, these vlogs, to hold myself accountable now going forward. I'm actually going to try documenting my food for the next week. So next week I'll post a video where you'll see everything I've eaten for the next week. But this is also serving as my first weigh-in video. Right now I weigh 373. So day one, January 6th, 2019, 373, and I hope to, vlog a lot more, and periodically I'll update my weight, at least once a week or so. There are other things I'm going to talk about on this channel as well. I'm going to share all of my health journey with you, every cancer-related test I have done, every doctor's visit, all of that. I'm also going to talk about my New Year's resolutions that I made, and I made 4. One was to finish a book that I have had in the back of my mind forever, so I'll share that when it's done. I'm going to read the Bible chronologically. I want to read 25 books this year, not necessarily just for pleasure, but also for personal growth, and I'll share those as I read them. And lastly, I want to lose 100 pounds, which for a guy of my size, 100 pounds in a year should be a piece of cake. So this is what 2019 is going to hold for me. Oh, I'm also decluttering our house, so I'll share some decluttering videos as we do them. My wife and I both realized we have too much stuff, and we want our house to be a nice, happy, peaceful, calm place. And to do that, we've got to get rid of a lot of stuff. So, thanks for watching. This was much longer than I thought it would be. Please feel free to subscribe. You can follow me on Instagram at The Ranger Project. And I am going to update my life here. So if you're interested, please follow me. Please help keep me accountable. Thanks again for listening. God bless, and I will see you next time. Bye.